For this lesson, we're going to talk about hematocrit. Now, before we get started, the thing that you need to know about hematocrit, or HCT, is that it's measured in a percentage. And we're going to get into all the percentages in a minute. But for male patients, this is going to be similar to the red blood cells and the hemoglobin, in that the values for males and female patients are actually going to be a little bit different. For male patients, it's going to be slightly higher, 41 to 50%. And then for females, it's going to be the 36 to 44% for normal values. So like I said, when we're talking about hematocrit, is that it's actually measured in a percentage. And when I say percentage, what we're talking about is the actual volume of the packed red blood cells, and that's compared to the total blood volume. So if you look at this tube right here, this right here is your total blood volume. And the red blood cells, like we call them erythrocytes, they're gonna take up this percentage right here, and then your plasma is gonna be that percentage right there. So if we look at the total volume of the blood, these erythrocytes in this blood sample are 45%. So what we do is we look at this, we look at hematocrit as a quick way to indicate things like anemia or other conditions where your patient's going to have really high hematocrit levels. So it gives us a quick reference as to what's going on with the patient in terms of their overall blood volume and any other potential problems. So you'll also measure this with hemoglobin or your red blood cells. So if you're looking at your red blood cell results and you see something's a little bit off, you can expect maybe your hemoglobin and your hematocrit to be off too. So your hemoglobin, your hematocrit, and your red blood cells are often always measured together, so you can get an indication into those three. I definitely recommend that you check out the lessons on hemoglobin and red blood cells so that you can get a better understanding of how all of these three lab values play together. So what do we need to be mindful of when we're submitting these blood samples to the lab? Well, you're going to submit them in a lavender top tube, which has EDTA in it, and this is your anti-clotting additive that keeps the sample fresh and keeps those measurements accurate. Now, like we talk about in the red blood cell and the hemoglobin lesson, we talk about technique, and technique is really important because what you want to do is you want to keep this from happening. Hemolysis is the breakdown of cells, particularly red blood cells. And what I mean by that is, let's say you have your syringe. This is your syringe, and it has your patient's sample in it, and here are your marks, and it's got this blood sample in it right here. And you get your sample from your patient and you inject it into this vacutainer, and you use force to push this down. What's going to happen is you're literally going to cause this breakdown of these RBCs, of these red blood cells, which is going to artificially decrease your red blood cell count and also your hemoglobin and your hematocrit. So we want to be mindful of that. So these vacutainers have negative pressure in them. So what you need to do is make sure that you just insert the syringe into the tube, and it will draw that sample from the syringe until it's full. Just make sure that you're not applying force. Don't apply force when you are introducing these samples into these tubes, because we don't want to have this breakdown of those red blood cells. Also, consider the size of the gauge of the needles that you're using. So if you're drawing, let's say your patient's a tough stick and you actually are using a lot of force to create negative pressure in the syringe, you're also going to get the breakdown of the red blood cells. So we want to keep that from happening. We want to get good sticks. We want to, if you need help, reach out to those veteran phlebotomists or veteran nurses. Sometimes you got to get providers involved, but make sure you're getting good samples when you're submitting these to the lab. So let's look at some abnormal lab values for hematocrit. So with increased hematocrit, just like with your red blood cells, you can expect some mild increases with things like dehydration. So if we go back where your plasma was 55% in that last one, well, if plasma is kind of a direct indication of water and hydration levels. So if you have a patient that has decreased plasma, so let's say let's draw your tube over here. So this is your tube, and this is your red blood cells, and let's say this is 45% red blood cells. And let's say you've got the 55% plasma. Well, let's say your patient's, let's say they're dehydrated. Well, all of a sudden this red blood cell count is going to go up because your total blood volume isn't going to change. you just have this higher amount of red blood cells. So this goes up and this goes down, and it's usually pretty mild. So you're going to see these mild changes in percentage. Remember that red blood cells are an indication of needs for oxygen. So if you have an increased need for oxygen, your body is going to compensate by increasing that the production of those red blood cells, because your body says, hey, we need more oxygen and we need more ways to do it. So with respiratory disease, you can see some increases. So pulmonary fibrosis, COPD, you have an increased need for O2. So you're going to have this increased need for these red blood cells. Polycythemia vera is another one you're going to need to pay attention to, because you're going to see this increase in hematocrit, and it's probably going to be one that's going to knock your socks off, because the hematocrit is usually extremely high. Polycythemia vera is an illness where you're going to have this overproduction of these red blood cell counts. Bone marrow is just going crazy, and so it's like, hey, we need to produce all these cells. So it's going to cause this hematocrit to jump excessively high, and the way providers typically treat this is going to be through bloodletting, so literally phlebotomy. They're going to pull volumes of blood off, and that's going to decrease the hematocrit. And you can also help patients with polycythemia vera by increasing their water intake, so making sure they're hydrated. Also, they may use some medications to do this as well. So what happens if the hematocrit is low? Well, decreased hematocrit levels are often caused by some sort of blood loss, whether this is through some sort of surgery or trauma or maybe another type of hemorrhage. So you're going to want to make sure that you stop the bleeding. That's your first order of business. And then you're probably going to do things like blood transfusions if they're at dangerous levels. Other reasons why you may see decreased hematocrit are through different types of anemia. So sickle cell anemia, you may see it in aplastic anemia. You may also see something called relative anemia, and that's through pregnancy. And that's because there's this increase in total volume of plasma. Another time you're going to see anemia is through the hormone erythropoietin, and that's with problems with kidney disease. And the kidneys, that's where the EPO is produced, so they're going to be damaged, and it's not going to produce it, and therefore you're going to have this lack of stimulation from the kidneys to tell the bone marrow to secrete the blood cells. And you may also see some red blood cell production and hematocrit as a result with diseases like leukemia. And that's because the bone marrow production is so vastly affected by the cancer. So with this, you can do chemo or radiation or even bone marrow transplants. And there are other ways to treat leukemia to help bring that hematocrit level back up. So for our nursing concepts for this lesson, we really focused on our lab values, and we also focused on oxygenation, since the hematocrit is in direct relation to the red blood cells, and they carry oxygen to our tissues. All right, so let's recap. Hematocrit is a percentage, and it's compared to the total volume of blood. And when you're looking at hematocrit, consider your red blood cell counts and your hemoglobin levels, because these are usually tested together. You always want to send it in a lavender top tube, and be careful with your technique to not cause the hemolysis. When you have elevated hematocrit counts, it's because there's an increased need for oxygen and the body's responding to it, or you actually have this overproduction of those red blood cells, and that's causing the hematocrit to be increased. And finally, when you have this decreased hematocrit, often look to blood loss or a decrease in the production as the cause of this low hematocrit. So that's our lesson for hematocrit. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today, and as always, happy nursing.